And that brings us to the next topic, which is timing. You are responsible for the timing of your surgery. Now, I don't mean scheduling it. The patient coordinator and the office that you go and get your surgery from, whatever it is, they're helping you with the scheduling. That is not timing. If you have weddings coming up, graduations, if you just had some significant life change, think about the timing of your surgery because anything can happen. And if you are getting married yourself, right, and you think you want to have a rhinoplasty or eyelid surgery 1, 2, 6, 9 months before that's going to happen, you might want to rethink that because anything can happen. So timing is not your surgeon's responsibility. It's not even their job to really ask you. It helps if they do. Like that last example about going to Maui with your new set of breasts, right? It helps if they think to ask you these things. If they think, maybe you even mentioned you're going to Hawaii, but they're still not going to ask you, oh, what are you going to do? You're going to go hiking? You're going to do this? You're going to do that? You got to communicate these things to you. But timing is the patient's responsibility, not the surgeon's. It is the surgeon's job to evaluate you, create a plan, execute the surgery, make sure you're taken care of after surgery, but timing is up to you. Now, let's go into a category of our surgeons, smart listeners, and smart communicators when it comes to eyelid surgery. Do not go into someone's office and say, oh, I want to look younger. My face, it's just falling apart. I'm falling apart. I want to look younger. I want to look better. That's fine. You can start with that, but you have to give them more information. Miss Lee, what do you mean? You feel like your face is falling apart. You want to look younger. We'll say, well, I'm happy with my chin. This part's good. I'm losing definition of my jaw. This jowl is bothering me. And so now you're starting to give that surgeon details. And again, hopefully they're asking you about these details. But you can't always rely on surgeons because why? They're not smart listeners and smart communicators. You got to remember that. They're intelligent. They're skilled. But they're kind of human stupid, all right? I don't know if you've been to a lot of consultations with plastic surgeons or doctors in general, but some of these people don't even make eye contact with you, all right? So just remember these things and come prepared. You got to help them out sometimes. That part's not really your job, only the timing is, but you never know, all right? Just try and communicate with these people. But so, for instance, for me, for eyelid surgery, the things that I'm looking for that are so important are the details. When I am thinking about planning someone's Asian eyelid surgery, I want to know, do they want to wear more makeup? Do they want to wear less? Do they want a tapered look? Do they want a parallel look? Do they want the crease up? Do they want the crease down? What is it? Sometimes it's just easier application of makeup. Sometimes they're actually pretty happy with the position of their crease, but they just want it to look tighter, or the lashes are hanging down too low. And so then I'm going to plan a surgery for that person who likes the position of their eyelid crease, but the lashes are kind of ptotic or sort of hanging in front of their eyes. And hopefully I'm going to get a crease that's really pretty much in the same position, has better definition, and the lashes are lifted up. Did I need to make their crease bigger? No. And I knew that because we had a conversation about what it was that specifically brought them in. It wasn't to make the crease bigger or to make their eyes younger. I mean, maybe it was. But there's a lot of other little details that people forget and surgeons forget. And so you got to do your best to kind of communicate.